And good morning, and very glad to be here, and especially see my old friends, and especially appreciate the invitation from the organizer and also my friends Min Heng Li. And today, uh, I would like to introduce our recent work on the colorectal cancer, and because as I studied follow Professor Dong in the United States, and basically we do a lot of work about the MAPK pathway, and this pathway actually is very important to sustain cancer cell growth. And recently, actually, uh, the small molecules targeting the BRAF target, also the MEK targets can be combined used for treat the melanoma and also the colorectal cancer. But still, the RAS mutation, that's very easy to see in the melanoma or the colorectal cancer, is still a very big challenge for the colorectal cancer treatment and also for the melanoma treatment. So today, Dr. Lee already, Professor Dong also use these slides to induce the cancer incidence globally. Here we can see the colorectal cancer already ranked the second after the lung cancer in the 2020 as a mortality of the cancer. Also in China, with the development of the economy and also the lifestyle change, now the colorectal cancer also rapidly increased. The incidence of colorectal cancer is also ranked the second. So people around the world and also in China, they face the challenge of colorectal cancer treatment and prevention. Here are slides to show that that's from 2003 to 2020, and we can see the colorectal cancer in China, especially in the urban area, dramatically increased in the incidence, also doubled the numbers of the colorectal cancer, especially, and I also collaboration with the hospital, the Henan Hospital, is affiliated to the Zhengzhou University, and they have over 3,000 beds. We see many patients dramatically increased, especially in colorectal cancer or also the breast cancer recently. For the current therapy of colorectal cancer, and most of the therapies are still in the early stage or in the middle stage. Uh, you can first do the surgery. For some middle stage colorectal cancer, probably you first need to give some uh, chemotherapy combination with the radiotherapy, and then probably after this period and the tumor shrank, and the surgeons can perform the surgery, and this is usually performed clinically, and for the advanced stage or metastasis stage of colorectal cancer, usually they just can accept the chemotherapy plus the neurotherapy, but the effectiveness is still very limited. And recently, actually, targeted therapy, especially for the some patients with EGFR high expression and also the HER2 high expression, they try to use this targeted therapy. And recently, actually, the targeted therapy, HER2 and EGFR in some patients shows the positive results, but this number is very limited. And also the PD-1 inhibitor and PD-L1 inhibitor now use a new combination therapy with the chemicals and show very increased number of patients get released after this therapy can sustain long time. But just as Dr. Lee mentioned, this antibody therapy combination with the radiotherapy, even they can increase the number of release, but this kind of patients they quickly get repulsed. And this cannabis plus actually is more resistant to the traditional therapy. So it's still a very, very challenge for the colorectal cancer treatment. And currently, the 5-year survival of the late stage colorectal cancer is only 14%. And also, just as I mentioned, the EGFR, the small molecule inhibitors, and also the mono antibody shows a promising, but drug resistant for either small molecules or the antibody. It's a very challenging topic for colorectal cancer therapy. One pathway we are very interested in is this RAS-RAF MEK pathway. This pathway actually for the colorectal cancer or the melanoma, we see actually the RAS mutation is very high percentage at the melanoma and also colorectal cancer, and also the RAF mutation is also seen in the colorectal cancer. So whether we can find some small molecules very effectively can block this pathway is also our purpose to pursue. This actually concept was mentioned by a Lancet article that the MAPK pathway is play a very important role in the colorectal cancer carcinogenesis or development, and this including the we know the winter beta-catenin this pathway actually the APC mutation or loss can cause this winter beta-catenin pathway activation and cause the carcinogenesis. And lately, actually, they also active the MAPK pathway and cause the COX increased. So MAPK pathway that's including like PS3, the EGFR signalings, and also the BRAF mutation, especially the V600A mutation, is highly incident in colorectal cancer and also a challenge of treatment. The RAS-RAF MEK ERK pathway is very important, but the problem is in the clinical practice, and if you use the MEK pathway and block the MEK pathway, suddenly actually they can active the other pathways, especially RAS-related pathways. That's called paradox activation. And if only use a blocker from the RAF, actually the MEK is also active. So clinically, to practice to prevent this paradox activation, the combination with the RAF inhibitor and also the MEK effector. But the effectiveness is still, we see, for not for a long time, the patient get resistance for this combination therapy. Where we can find a compound both target RAF and MEK pathway. So one job we do here is we found actually from a traditional Chinese herb we call the dendrobium. This dendrobium also checked in Chinese name is Sihu. Actually, this is also used in Korean medicine for the health, and also they make some cosmetics use this ingredient. In this, we found actually that's one compound we call adenine. This adenine is a double-benzylized compound. The one story I found interesting in this compound because one time after take a vacation, I go to one mountain area. Actually, that mountain area, the many farmers they plant these herbals. They think they sow the herbals, along the roadside. They said this benefit for your health and especially for the gastric cancer, gastric for the stomach or for the lung. So I buy something and probably think some ingredients in these herbals should be used for found some very interesting compound. And luckily, through this kind of screening, we found adenine as from this herb, and we first do a case profile, and interestingly we found this adenine can inhibit both CRAF and MEK2. Because MEK2 and MEK1 is very similar, we hypothesize probably it's also inhibit the MEK1. And later, actually, we performed a study to the pull-down assay. Here we can see that after performing the pull-down, and we see both the CRAF and the MEK2, MEK1, they can be pulled down by this compound, and also we use the cell lysis, and we can see also the pull down results. An experiment we perform, we use SPR assay because the very sensitive assay, we see the small molecules and can react, can bonding with the proteins, and we performed this kind of SPR assay, and we see MEK1, MEK2, and CRAF have a very quickly response, nice response to this compound, and also we use already known MEK inhibitor and CRAF the RAF inhibitor as a control. We see also the positive results. So nextly, we also perform the ITC experiments, and we see both these three targets, MEK1, MEK2, and the CRAF, have a nice response to the ITC experiment. Just as Professor Dong said, and probably, and we want found the detailed mechanism how this compound works. Then we use a computer simulation, the docking. We found actually this compound can bonding with the MEK1, MEK2, and the CRAF, especially at the active pockets, and but MEK1, MEK2, and CRAF is different. For the MEK1, is at 146 sites and 124 sites. For MEK2, here I cannot see clear, is different. CRAF is 375 amino acid, the bonding sites. We actually, after this prediction, we mutation these sites and perform the bonding assay again. We see after this mutation, the bonding affinity is decreased with this mutation. And nextly, when we also do the in-cell affinity tests, we treat the cell with this compound, and also heating these cells, and with a different temperature. And if one target is bonding with compound bonding with the target, and actually the target is more stable, and then we do the Western blot and check their stability. We found that after bonding, after treatment, actually MEK1, MEK2, and CRAF both more stable after this treatment. So after we verify this compound can bonding with these three targets, and the next steps we see whether this kind of compound can inhibit the kinase activity of these three kinase. We promote the kinase assay, and with the downstream proteins, we found that actually this compound can inhibit both MEK1, MEK2, and CRAF to phosphorylation its downstream targets. And at the same time, I use the CRAF positive control compound and the MEK inhibitors we found actually this compound work well. And then we determined whether this compound has a very good function effect. We both use melanoma cells and the colorectal cancer cells. We see actually this compound have a very good response and compare with the already clinical used inhibitor, both MEK inhibitors and BRAF inhibitors, and the use is adenine compound shows very active effects. And we also use another platform to test its function. We see actually here this is the melanoma cell lines, here is the colorectal cell lines, and we can see here actually work very well compared to the BRAF inhibitor and the MEK inhibitor. So this gives us the confidence to continue do the in vivo study. Uh, Sorry, I missed another platform with the use of soft agar assay. We see actually at nanomolar 25, actually it's very sensitive, almost suppress all the clone growth of this HCT116 cells and compare with other already clinical used drugs. And then we performed use melanoma cell lines or colorectal cell lines. We performed the CDX assay. Here we can see that this urine, even the solo used, the green one we see here have a very good response. If combination with the BRAF inhibitor is show very effective. So nextly, and we actually set two PDX model. We set up the melanoma PDX model and also the colorectal cancer PDX model. We treat with this compound. We see here that after this combination and the urine itself show very effective, and also for the colorectal PDX we see very good effects. So as summary, here we proposed as this CRAF inhibitor, and the ironin, it's very effective inhibitor, can both inhibit the MEK and also the CRAF, these two compounds. Because this kind of two targets suppression and avoid the paradox activation of BRAF single use or MEK single use, and also show very good clinical effects. And later we will continue to modify these compounds and for future clinical use. But the only drawback of these compounds, if for the drug metabolism, is very quickly. It's only sustained several hours. So we now its modification want to increase the availability in the blood, sustain very high concentration to increase its effect. And that's the results were recently published in the STTT journals, and also the journal give a very good comment about these compounds. So I'd like to express my deep appreciation to my collaborators and also my teachers, Professor Zgang Dong, Professor Ziming Dong, and also my very good colleagues, Dr. Minheng Li and Dongjun Kim, and also Fang Fang, and also other students. And also I'd like to support from the SFC of China. Thank you.